Okay, so here we are arriving at the German Medical Institute. You drive up the drive here and then you enter into the main reception here. You walk through the doors of the main reception and you'll be greeted by the reception team. They're going to take your initial information so that they can log you onto the system, and they'll show you the way to go where you'll meet Marina for the first time. So now we are here meeting Marina for the first time. Again, you check in with Marina, she'll take some information from you, and you'll wait here in the waiting room until Dr. Georgiou is available for the consultation. So now you're having your pre-op with Dr. Georgiou. This is where you'll be discussing the requirements for your surgery. You'll be talking about any information that you need to do in preparation for surgery. He'll be talking to you about whether or not you're on first or second tomorrow. And it's really an opportunity for you to talk to the doctor about any last minute questions you have, maybe any changes that you might have, or really just to settle your nerves ahead of the surgery on the next day. Okay, so you've arrived for your surgery day. You're going to feel excited because of the life-changing surgery that's about to happen, but let's just talk through what the morning will look like for you. So first of all, you're back to the main reception. Again, you need to check in there and make sure you give all your information. You'll then come over and you'll meet the lovely Antigone, who is going to be the admissions officer. So again, more information. You'll sign consent forms here. She'll give you your file and then she'll walk you up to the 4th floor, which is where you're going to be stationed for the morning before you go ahead for surgery. Okay, so now you're reaching into the 4th floor. First of all, you're going to meet the nursing team at the reception desk here. Again, they'll ask for your file and there'll be some more information that you'll share with them before they then show you into your room. Once you get into your room, you've got an opportunity now to get yourself settled before surgery. So you can unpack your bag, you can put things in the locker, you can make sure that you can use the safe and put anything in the safe that you need to put in there for security reasons. And you have the opportunity now to rest and relax before your surgery. You'll change into the gown and you'll wait for the surgical team to come up. Dr. Georgiou and the team will come up. Again, a last minute conversation before you go for surgery. You'll be marked up for surgery. And again, you've got that opportunity just to talk through what to expect, and also any last minute questions or information that you need, you can discuss this. You'll also meet some of the nursing team while you're waiting for surgery. So here's Maria, the lovely Maria, who's going to come in and she's talking me through right now about the TV. There is a TV in the room. She'll also be showing you how to work the bed. It's really important that you know how to use the bed because she'll show you how to lift it to its highest point, and that's the best view because when you're at the highest point on the bed you actually get to look out the windows and over Limassol. So make sure that you know how to operate the bed so you can get that view, especially for the sunrises and the sunsets. It's beautiful and one of the best things when you're recovering. Okay, so now it's time for you to go down to the 1st floor for your surgery. So the porter's going to come into the room. He'll then help you get into the wheelchair. They'll place a blanket over your knees and they'll give you your file. And then you'll be taken down into the 1st floor. So this is where you meet the surgical team for the first time. The nurses will greet you at the surgery door and you're taken in for pre-observations first. Okay, so you'll wake up on day 1 after surgery, and the first thing that happens in the morning is that the doctors will come in to see how you're doing, and they'll be doing some observations. They'll also be having a first look at your new legs or your new arms. So again, a conversation. They'll let you know how surgery went the day before. They'll also let you see your legs and talk you through how the surgery went, and also an opportunity for you to ask any questions that you might have at that point. The second thing that happens in the first morning after surgery is that you'll meet Christos Iakovos or one of the other MLD therapists who will come to give you MLD for the first time. So this is the first time that you really see your legs as well when the compression comes off, and you'll have that first treatment in the hospital. You receive MLD every day while you're in the hospital, and then Christos and yourself will make a decision and an agreement on how you will have MLD once you leave the hospital after discharge. So thanks for walking through what to expect in your pre-operation and the day of surgery and the day after. If you have any other questions or thoughts, make sure you reach out to Dr. Georgiou and the team. They'll walk you through any other questions you might have.